Hey everybody, and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and today we're looking at a CLL, a chronic lymphocytic leukemia.
I almost forgot my line, Melissa. It's been so long.
I know it's been a while. We've had a lot of stuff going on in our lives, and
Yes, yes, we have. You more than me, maybe, but
yeah, but we've both been pretty busy. So,
mm.
but we're back, and we've got a CLL for everybody today.
Yep. And we're starting on 10x, which is where I always like to start. And I try as I might try to convince students 10x, 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 but it's a really, really valuable objective to kind of get your bearings on. So, do you want to talk about what you see and what kind of we're looking for, or?
Yeah, especially so 10x for everything, but notice how every diff we don't start on 10x. For the videos, we'll start right in where we're looking, but we wanted to start on 10x because CLL has a very characteristic classic presentation that you can easily see on 10x. So when you're looking on 10x, you can see there's a bunch of monotonous mononuclear cells everywhere. You don't see much else.
Right.
Other
Yeah,
than
this
that, the smudgies.
right. Like there's no replacement for flow cytometry and cytogenetics and diagnostics, but we're pretty good CLL detectors at this stage in our career. So like what we see here in this picture, I see a lot of kind of monotonous, they all look the same, mononuclear blue spots. My eye can also see a lot of smudge cells.
Yeah. And so
Um,
let's just point them out. These are the smudge cells that we're seeing. It just kind of looks like purple blobs.
mhm.
And notice how there's a lot of them.
Yes, yes.
So smudge cells are not pathognomonic, but basically,
Almost, right? Like you like it's when I see smudge cells, the two things that come to mind for me instantly are CLL, and the other would be like viral lymphocytosis, kind of a reactive picture.
yeah,
Um, but this amount of smudge is this
classic.
is I mean, this is such a perfect picture of what CLL
It's almost
uh,
textbook.
it is. Yeah, I would agree.
Lots of
Uh,
limbs. You're going to have a majority of limbs, these mononuclear cells, or prolimbs, depending on the patient,
True. Yep.
and
Yep.
then all the smudge cells.
Yep.
Now, what
Uh,
we can do is we could use an albumin prep to get
mhm.
rid of the smudge cells.
Yep.
What's an albumin prep?
Been a little while. So I think the typical preparation, at least the one that I'm used to at my particular institution, was 1 part albumin to 4 parts blood. And we would just kind of eyeball with a dropper. It doesn't need to be precise. And that albumin helps a lot during the smudging process to kind of preserve them, but it does alter morphology considerably. So red cell morphology, no, no, no on an albumin. Don't use an albumin for red cell morphology. And it will make the lymphocytes and other white cells look a little bit different, right? They can be a little bit darker in color, and maybe even appear a little bit larger. But it's great for, if you were to do a differential on this particular slide, it may not impact the relative lymph count too much because there's just so many. But theoretically, the cells that have been smudged, you're not going to be able to identify, and so they won't be represented in the differential. So albumin preps are really valuable in that regard.
Bam, albumin prep.
They look you know um, prettier in a lot of ways, I think.
Well, we'll look at this after so that they
Cool,
can
cool.
see what an albumin. This is the same slide, just with albumin.
Awesome.
And just for a little background, the albumin, the reason why we do the albumin is because what it does is it's protein. It just coats the cells. And so the smudge cells are not smudge cells in your body. They're smudge cells because of that smear making process. And so essentially what we're doing with the albumin is we're coating it to strengthen it. so that it doesn't smudge during that smear making process, because they're just very fragile cells. So that's where the smudge cells come from, is the smear making process. They're very fragile. And then why we use albumin, or some places will use albumin. Some hematology oncology doctors don't like to take the pro lymph count or the blast count from the albumin prep, and that will be dependent upon whatever chemotherapeutic regimen or whatever tool they are using to classify and distinguish their CLLs. So that'll vary from hemonc doc to hemonc doc. But for our purposes, if you have to use an albumin prep, we'll show you what that looks like too. And yeah, like Dave said, you don't do red cell morph or a platelet estimate off of the albumin prep. You only do your differential off of the albumin prep. So this is not an albumin prep.
Right. Yep.
You can see it from all the smudgies. Smudgies. All right. So now what we're going to do is we're going to drop down to 40 so that we can see a little bit closer. All right. So here's 40x.
We're back in higher magnification.
Yep. So we can see the nice smudgies up close and what they look like.
Yep. Yep. Yeah. And there's considerable just in this frame, right? And it's not like we selected, this is just a random kind of area we went down to. So roughly half the nucleated cells are broken.
Yep. And then you can see that the other cells in here, they're just mononuclear.
Yep.
Now, remember, students and new techs should not be doing their diffs on 40x.
No. Yeah. Right.
Not until you take a checkout as a tech, and then you're comfortable and you can actually see those minute fine details. So our 40x is more for finding a good area. Once you go on your 10x and you find that great area, then you want to drop down and adjust your minutely with the 40x. And then, this is where you're going to do your white cell estimate if you're doing one, and, just that kind of stuff. And so we're just kind of glancing and saying, oh, look, I already know there's smudge cells here. I already see that this is a very monotonous picture. So I already know what to expect now in greater detail. Yep. And now let's drop down to 100.
Cool.
Okay, so here we are on 100x. You can see we found some nice lymphs.
I'm going to move my Melissa's face.
I'm having a hard time. Say that again, Dave. I had a hard time hearing.
Sorry, yeah, I was moving your face out of your face was over the lymphocyte. But yeah, we see, characteristic lymphocytes, right? These are kind of I hesitate to use normal resting given the pathology, but resting lymphs.
Yeah. Which is typical. You don't usually see the reactive forms. I mean, occasionally, but for the most part in CLL, it's just they look like normal resting limbs.
Yep. So
both of those are limbs. The other thing to point out is that there's a decent number of platelets.
Yep.
There's one here.
And so why did you note that? Very good. I'm glad you brought that up.
I think that might be one. There's a bunch of them. And I brought that up because it's chronic, right? So with your acutes, you expect to have the thrombocytopenia at initial presentation because of the myelophthisic anemia. What? I like that word. So the bone marrow gets taken over by the malignant population and displaces normal hematopoiesis, so normal red cell and platelet development. And so usually patients present with thrombocytopenia in your acute leukemias. Because we're dealing with a chronic, these patients usually are not thrombocytopenic. So that's just why I brought that up, is that there's a normal number of platelets. Now, we're probably not going to see the anemia, just kind of glancing at the peripheral blood smear. That's probably more something that we'd see in the CBC unless it's a really severe anemia. But again, I wouldn't expect that severe anemia. Like we saw in the ALL video. Remember that ALL video? There was like red cells dispersed. The red cells were not close together. We couldn't find a good area by definition of finding a good area, looking where the red cells are starting to touch and overlap. But that patient was just so anemic. So you're not expecting to find that in the acutes. you expect to find that in the acutes and not the chronics.
Mm-hmm.
That's
Yep.
why we don't see that here.
Yep. Yeah, and I've seen acute leukemias that have an okay H&H, right? There's a fair amount of red cells.
Yep.
But platelets are just such a sensitive indicator, right? Like once an acute leukemia has taken a foothold, platelets just fall off a cliff and just disappear. So yeah, when you first look and you see platelets, you're not as it's not as much of an emergency necessarily, right? And so that colors how you interpret things.
Yep. All right, let's move on over, move around. Oh, let's go.
Smudging, more lymphies.
But look, there's actually a neutrophil.
There's a neutrophil.
Yeah, so we've got some nice smudgies. This a little bit. All right, yeah, so we got some smudgies, and I don't know of an institution that enumerates smudgies. Usually, it's a qualitative finding. So you just say that they're present when you see smudge cells, and it's excess smudge cells. So each institution will have their own. If you see X amount of smudge cells, you call smudge cells as present, because you could find smudge cells in normal slides, just not this quantity. Right. And then I think too, in some ALLs, you'll also see some smudge cells, but again, not this, excuse me, quantity of smudge cells. So we've got a lymph.
A granular lymph too.
A granular one, yeah. You can see the little granules right in here. And then you got another lymph over here. And another one there.
Yep.
And then a neutrophil.
And for the most part, very normal morphologies. Nothing that's like scary.
Yeah, the oddity here would just be the sheer number of lymphs with the smudge cells. Typically, because it's chronic, you're going to find it in adults, not children, right? Remember, babies have a reverse diff where they have more lymphocytes than they do neutrophils, but you would not expect to see that in an adult unless there's a viral infection or CLL.
Right. And even then, you're going to see most likely reactive lymphocyte pictures, not these numerous resting lymphs. Yeah.
Let's just move around and see what we find. Okay. And so just wanted to point out here, like this guy's got a little cleft in it. This guy's also got a little cleft. Clefted neutrophils are characteristic that you see a lot in CLL.
Clefted lymphocytes.
Yeah. Sorry.
You said
clefted lymphs.
Yeah. No worries.
Yeah. So our clefted lymphs, not neutrophils.
Yeah, and they are somewhat common, right? Like, yeah, definitely.
Yeah. Although I will say I have seen it in the reactive pictures as well, like the really reactive pictures, but it's not quite as common in reactive lymphocytic pictures. It's very common in CLL. Some more smudgies. And a lymph.
So I always like when you have like a normal or normalish and then the abnormal cell. So, and on my screen, top left is a really condensed resting lymph. And then center-ish fields, we have a chromatin pattern that's much more loose and a very, very, very prominent nucleoli, suggesting some level of immaturity, right? So these are the findings. You know, many times when you're doing a CLL diff, it's more of a routine thing, right? They're monitoring disease and things like that. But finding a cell like this, which appears to me to be a pro-lymphocyte, is more significant and may require a pathologist review and more of an in-depth monitoring of the disease, probably.
Yeah. So it'll vary by patient. Different patients will have pro-lymphs and some won't have any pro-lymphs. So it just depends on your patient population. And so this patient in particular has pro-lymphocytes. But as we keep scrolling around, just have everybody watching be cognizant of you're not going to see a good number of pro-lymphs when we're looking at it on the regular prep.
Right.
And
Right.
it's because the pro-lymphs are usually more fragile than the lymphs. So they are a lot of times are part of the smudge cell population. So you don't see pro-lymphs a lot of times on the regular prep. You see them on the albumin prep.
Yep. That's absolutely right. Good point.
So then let's take a
And
quick second and talk about the maturation of lymphs.
yeah, I don't want to do that. So this is a little joke. Like lymphocytes are incredibly complicated. Look, all biology in general, we're very complicated organisms, and there's lots of things going on. Lymphocytes in particular are very, very complicated.
Lymphocytes, I always say this. I think I've said this in a past video. They are the bane of our existence as Labradorians. But there's immunological maturation and then there's morphological maturation. And so let's just talk about morphological maturation and keep it simple.
I like that. Yeah, so morphologically, we only have like what, 3 buckets really to put lymphocytes in? Like blast, pro, and then mature, right?
Basically, yeah. So there's the lymphoblast, the prolymphocyte, the lymph, and then I guess you could say like there's the reactive lymph and the plasma cell. But
Right.
when you're just looking at through naive, right, through that
Mhm.
first mature stage, the lymph, that's where we get the blast, the pro, and then the actual lymph. So this is a prolymphocyte.
Right.
And why did we, Dave, why did you and I go right to pro and not to a blast?
Sure. Yeah, no, it's a great question. I think when you, as a student, as you learn morphologies and you're learning things like blasts, the nucleoli becomes like a red flag of sorts, right? But what I see in this particular cell is that there's some areas that are like clumps, right? There's some parts of the nucleus showing some clumping. And so it's not as immature as it gets. It's not quite blast, but it's also noticeably less condensed than its little brother up in the corner. So it falls in the middle. So these are difficult calls, but in a sense, the way my particular brain is working on this morph call is it's not super condensed like the one up there, and it's not fully blast. Therefore, it just falls in the middle there at that prolymph.
So I highlighted here just the areas of heterochromatin, so the clumpiness, so that people can see now. See those dark purple areas? That's what Dave is talking about with the clumpiness. So that's the mature locations. That and also you can really see a lot of the prominent white striations throughout the rest of that light purple nucleus. The other thing is that nucleoli.
Mm-hmm. Yeah,
It's
it's
huge.
very large. Yeah.
Yeah, prolymphocytes in general, or what I've seen, these malignant prolymphs, they usually have larger nucleoli than even the blast, the lymphoblasts.
Mm-hmm. Yeah.
So, and I pointed out the heterochromatin, and now I'm going to point out the actual nucleoli. And I just pointed out because that was a round bit of heterochromatin. That's not nucleoli. This is that giant nucleoli. Remember, it should kind of look like a hole punch. So you
Mm-hmm.
took a hole puncher right to the nucleus. So that's what that is, that giant nucleoli. It probably takes up almost like a quarter of the nucleus.
Yep. Yep. It's significant. The other thing I forgot to mention too is the cell size,
Mm.
right? So less mature cells typically are a little bit larger, and
Yeah.
so another indication that it's likely a prolymph.
Yeah, and it's definitely much larger than these little resting lymph guys.
Yep.
So definitely. So we've got a nice looking pro lymphocyte over here, and it's exciting that we got to see it on a regular prep.
And a good one too, right? Like these are like the teaching ones. There'll always be those tougher calls where one might elect to call it a prolymph, one might not
Yep,
elect to call it a prolymph. But this one's pretty clear, I think, being
that was nice.
less controversial. Yeah.
We love the straightforward cells.
Me too. Yep. Sign me up.
She like just like look like you get these really kind of weird shapes
Mm-hmm.
to it, and keep focusing. There we go. Just odd shapes to the nuclei of these really nice, otherwise resting lymphocytes.
I think that's another thing that a morphologist should kind of look for. Um, it's not specific for anything. It doesn't necessarily mean anything on its own, but I start to pay attention when I see irregular nuclear contours and things like that.
Definitely. And I'm just gonna that guy that's in the field. I'm pulling him into the field. I know people are looking at him like, what about that?
Yeah, yeah. And this is where it gets difficult, where, you know, now a lymph that has irregular contours that is a little less mature, now we start to like, it could look like a mono, right? And then so this gets like really, really complicated. But yeah, that's the cell that we're talking about about here, the elephant in the room.
Yeah.
um yeah, that's a high NC ratio, so I'm kind of away from the monocall, and I'm thinking like a less mature lymphocyte. Whether or not we can call it a pro-lymph gets a little trickier, I guess. Depends on how you want to. Okay,
So
so
we
yep,
have this guy then that we would potentially call a pro
yeah,
lymphocyte. I almost said
yeah,
pro monocyte.
yeah. I think pro-lymph is where I'd lean, and then I'd have to defer to, we. It's like a broken record, right? But institution, procedure, if the procedure itself calls for very specific things, because there's not like a super prominent nucleoli here that I can see, but it's clearly not like a regular resting lymph.
Right.
So, and it's also not reactive, right? So it's you finding the right bucket to put it
Yeah.
in.
And it's
Um,
not blasty.
right, absolutely not. Right.
The cytoplasm and also the nucleus, it doesn't say mono. So the cytoplasm, I feel like, is a little bit blue, but it matches that pro-lymph that we just saw. And it's starting to look like the lymphocytic cytoplasm.
Yep.
And then the nucleus, I would say, doesn't look mono-y because of this big dark area of heterochromatin.
100% agree. Yep. That's too much clumping
Yeah.
for a monocyte. Yeah. I would expect to see a little more cytoplasm in a monocyte too.
Yeah, usually.
More equal to a 1-to-1 than this is a big nucleus for.
Yeah.
Yeah.
All right. Let's
Yeah.
keep chugging along. See what
Yeah.
else
Yeah.
we find.
See what the slide gods give us.
Lots of smudgies. Ooh, baby.
Ooh, okay. So that looks kind of reactive, right? You got
Yeah.
yeah, that's an interesting one.
I don't know that I want to call him reactive though, just in the context of CLL. I
100% agree with you. Yep.
feel like it's a CLL lymph.
Yep.
It's not reactive enough in the cytoplasm,
Right.
and the nucleus doesn't look reactive. It looks almost like if you ever hear like the soccer ball style lymph, you
Yeah.
can start seeing like the dark clumps, like the circles of the heterochromatin. It's not a perfect soccer ball, but it has more of that soccer ball appearance to it that I'd expect in the CLL. And then it's got the clefting. And this one's clefting on both sides, but again, classic CLL lymph look.
Yeah. I agree. Yeah, we're kind of like looking around hoping to find this soccer ball kind of pattern, and
Yeah.
it's again, I don't know that it's diagnostic, right? I wouldn't ever go that far. But when you start to look, all the evidence starts to layer on top of one another, and all these things that we're talking about, we saw a prolymph, the smudge cells, the number of mononuclear cells, this soccer ball pattern now we're seeing, it's all just like CLL, right?
A number
So
of mature lymphs.
yeah,
And pro-lymphocytes, you don't really see them in much else. Could
right,
you see them in an ALL potentially? But really that's more blast. You don't see a lot of pro lymphs for the most part with cases of ALL. So when
right,
you're seeing a pro lymph, it's typically either a CLL or a PLL, the pro lymphocytic leukemia.
right, and which, yeah, pro-lymphocytic leukemia, very aggressive.
Yeah.
Yeah, ugh. Um, yeah.
Let's see. If we got
Let's
any
see what
other
else we can.
nice looking. Oh, this one's not bad.
Yeah. So the ratios maybe aren't perfect, but the differential, those really fine, dense heterochromatin, and
Yeah.
then like less dense, and then yeah, this is the pattern that we are quote unquote soccer ball kind of
And the
pattern.
prominent white striations too.
Yes. Yep.
That's the other thing. That's important with them.
So it's a pretty good one right
That is a
there.
nice one. And actually, the other thing, oh no, the cytoplasm doesn't look quite as dark on this, so
Yeah.
we wouldn't think of it as reactive. Let's see. I'm just gonna kind of scan around quick and see if I see any
Sure.
others
Yep.
that are quite that nice. Oh, let's do this. It's not in the field. Oh no, it is in the field. There it is. There, this one.
That thing. So it looks very, very dense, the nucleus there.
Yeah, and look
Oh, is
at
it a basal?
yeah,
Oh, okay. I got a little fooled there.
yeah, it's great. So it does look. That's why the nucleus looks so dense because it's a baso nucleus with all the granules, and then you see the cytoplasm.
That's
Yeah.
that's what did it. Was that once I saw the granules in the cytoplasm and my brain woke up from its slumber.
So that's the characteristic look with the basos and the granules and kind of the washed out, and you can kind of see it looks like it's leaking out of the cytoplasm.
Yep, yep, yep.
But I like to put it here because look at the lymph.
Yeah, yep. And you know, I when I first started instructing, I never thought basophils and lymphs would be a thing, but it
They're a
is a thing.
thing.
It is a thing with
Yeah,
students.
yeah.
So yeah, I think initially when they look at a basophil, they're like, oh, you can't. The nucleus is dark. Therefore, every cell where you have a nucleus that takes up a lot of space and is dark may be a basophil,
Yep.
right? But yeah, we could see the lymph in the bottom of the field. There's no granules in the cytoplasm at all. It's nice blue cytoplasm. So I like to tell our younger intro heme kind of students, if it's a blue cytoplasm, it is not a basophil. Full stop. Yeah.
Agreed. Let's see. Yeah, really, it's just more of these lymphs,
Mm-hmm.
like that guy. So
Ooh.
actually, that's a good one to kind of glance at because
Yeah.
I think that's still a lymph.
Yeah, me too. Yep. This is mean. You know what? Like, hopefully, where there aren't students out there learning heme, right, and lymphs and monos with a slide like this, right?
Don't look at this slide if you're learning lymphs versus monos. This is more of an advanced slide.
So Melissa pointed out clefting in the lymphs. This is like an extreme cleft in a lymphocyte. And the thing that tells me that it's not a monocyte, number one, cell size, and number two, the NC ratio. So the amount of cytoplasm that's visually available here, it's just not consistent with a monocyte. But you know, a student would be wise to see the pattern and notice that it's not as clumps. So that's excellent that you're seeing that. But this is again just a less mature lymph. So this is probably more like our prolymphocyte, and I see a pretty prominent nucleoli in the nucleus there. So, given the history and everything, I'd be comfortable calling this a prolymph.
Yeah, I
But
think it's kind of in between a prolymph and a lymph because
yeah,
the nuclear material looks a little bit clumpier than the pro
agreed.
that we saw before. So
Agreed.
in the nucleoli, it's very prominent and large, but I feel like it's starting to
Close
remnant.
up.
But
Yeah,
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 it
yeah.
could be either or a pro lymph or lymph. But the point is not a mono.
It's yes, very much, and that's a tricky call. Yeah, um, yeah, that's a good sell though. And I like also in the field here on the right, we could see a very similar clefting, but a more mature nuclear pattern, right? Much more condensed. Yeah. That's a good cell.
Let the neighbor cells kind of guide you too.
Yes. Always do your differentials in the context, right, of the field and everything that's going on. I think that's part of the what makes hematology maybe frustrating for some is that where that art meets that science, and there's a little bit of judgment involved. But
Definitely.
you grow to love it.
Okay, so we transitioned over to the albumin slide so that we could take a look at the difference. And I think the biggest difference is one, we're not going to see smudge cells. Really, I mean, we could see an occasional smudge cell, but we're not going to see a lot of smudge cells like we saw on the regular prep. And then the other thing I think that we're going to notice with regards to looking at the white cells is that like they might look a little bit bluer or darker around the edges.
Yeah. Yeah, 100%. That's one of the reasons why a physician might be leery of a differential result off of an albumin, is it because it could really kind of false push you in a different direction. But on the other side of things, the center field looks like a pro lymphy kind of looking cell that may have exploded if not for the albumin preparation, right? So, but
This
this is like a beautiful, yeah, exactly.
yeah,
Thank you.
that's the prolymph we're talking about here. And then outside of the neutrophil,
Right.
everything else is just a regular lymph. Even this.
Right. Yeah.
I don't know that it's a regular lymph, but it's not a prolymph. It's a lymphocyte. It's clearly a malignant lymphocyte, but it's just a small round resting lymph.
Yeah. Yeah. Again, these are the buckets, and we have to pick the best bucket. And
Yep.
yeah.
Yeah. So everything else is a lymph then, except for the obviously the neutrophil.
Yeah. Agreed.
And then let's just more so I can clear. I just want to see some more of these nice looking lymphocytes. That's a neutrophil, not a lymph. Oh, here's nice. But all just a bunch of resting lymphocytes. But again, the key is there's no more smudge cells, really.
Right. Some of them look like they might want to be,
Yeah.
breaking. Um,
Ooh, this is a nice area. So I'm going to push it over a little bit more. I didn't want to lose those. Okay, I'll push it over a little bit more after. But these guys, right? So one thing, loss of contact inhibition, right? So they're touching each other. But again, just kind of looking at these, like this, it's just a
to lymph.
resting lymph.
Yeah.
So all lymphocytes. I think this one has some nice, really dark areas of heterochromatin in it,
I see that. Yep.
like you were talking about on the regular slide for the soccer ball. There's not a lot of white striations, so we don't see it as much as a soccer ball, but you can see the heterochromatin.
Mm-hmm. Yep. But yeah, always be suspicious when you see cells clumped together, because statistically very improbable for normal cells to be touching like that.
And then there's a guy over here.
There's a guy. Oh. So, and this is at the point where a pro-lymphocyte might start to like look like a blast almost, right? Like it really starts to aggravate the morphology. It gets more extreme.
Mm-hmm.
Really cool though.
Yep. Yeah.
It looks like a lot of nucleoli.
Yes. You can see at least three or four. Four, maybe five.
And troubling.
There's another one over here. Let's see what this
More reasonable looking.
Yeah. More reasonable looking pro lymph.
Yeah, I think yes. The other one was much scarier.
Yeah. I think the other thing to this one's not doing it as much, but a lot of times in red cell morphology, you see a lot of stomatocytes on an albumin prep. But like I said, this one's not doing it, but a lot of times you do see a lot of stomatocytes.
There's one top of field above that pro lymph that was kind of a little.
Yeah, right there.
Yep, yep. So for the most part, the red cells are behaving, but because of that cell and others that could look like it, you don't want to be using this for red cell morph.
Yes. Oh, there's a really nice pro lymph over here that I'm gonna go to now.
Prominent nucleoli, larger cell. Chromatin's a little bit more lacy relative to the clumped one. Yeah.
Comparing it to these guys over here, just regular old lymphies.
But it's clearly not a monocyte. So
Yep.
that's
It's clearly not a mono, and it's too clumpy to be a blast.
right. Right.
All right. So I think the big takeaway from this slide is the pro lymphs. You may see them, you may not see them in CLL, but if you do, they have that really, really prominent nucleoli, and they're a little bit larger than lymphs. And then the lymphs, really CLL, that's the thing, is the lymphs. So the small, round, resting lymphs, but they can cleft and kind of make odd shapes when we're looking at a CLL. You want to add anything else to that?
I think that about covers it. Yeah, I think so.
All right. Well, that's all we have for today. So thanks for watching.
Thank you.
Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video. And feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.